All right, everybody. We don't have a minute to waste here. I am Dr. Derek with the Lighthouse Chiropractic and Acupuncture here in Wichita, Kansas. And this is our Light in the Dark series. Now, who this is really made for is parents, or maybe you have a friend or family member who has kiddos who struggle with colic, asthma, reflux, bedwetting, sensory issues, maybe missed milestones, maybe even things like anxiety or depression. There's a number of things that plague our kids nowadays, and it's really easy, especially if you're a parent who's struggling with this, to feel helpless, and so what you're going to hear from me today is sometimes I'm going to have my doctor hat on, and sometimes I'm going to be talking about how I approach things clinically with my patients, and sometimes I'm going to be talking about how I approach things as a father, or how Dr. Haley and Dr. Devin, who you're going to hear about here in just a second, how they approach things as mothers. And so, what I want you to understand is that I feel you. I understand I've got four children. Dr. Devin, who you see over on the left, her husband, Dr. Joey, they have five children. Dr. Haley on the right, she has five children. And so, yes, we approach some of the things that we're going to talk about today as chiropractors and as doctors, but we also approach things as parents. So we feel you. We know that you're searching for answers. We know that you're looking for hope. And I hope that we can give you some clarity on why kiddos struggle from a lot of the things that we're going to talk about here in just a second. Now, one thing I do want to mention is I'm probably not going to get to every single question. A lot of times, when we're going through things, I've tried to jam things into about 35 or 40 minutes, and so sometimes it's difficult to get the Q&A section. So I'm going to have Dr. Jess, my wife, drop into the chat my email. The first thing I want you to do, this is your first action step. If I say something that resonates with you, I want you to immediately start planting seeds for an email, something, that question that you can ask me. I don't want you to wait on that, because I'm here to answer your questions. And I know there's things that I'm going to say that are going to strike a chord, and I don't want you to lose that thought. And so the first thing that we're going to do is have access to us via email. So like I said, Dr. Devin, you see over on the left, she is the owner and the chief visionary officer here at the LightHouse. She started the LightHouse Chiropractic over 12 years ago. It's been an incredible journey, but she's been a leader in our community here in Wichita for pregnancy and pediatric chiropractic care. And then myself, I'm there in the middle with my family, my wife, Dr. Jess, she's a chiropractor as well, and Dr. Haley on the right. I'm lucky to join my two sisters and my wife in practice here. They're incredible women in my life, but like I said, we're going to approach things from our doctor hats, but also from our parent hats as well. Now, I want to start with a quick message from Dr. Devin here. She's got about a 6-minute video. We're just going to play a little snippet of it today, and then Dr. Jess is going to drop the rest of that video in the chat.
The key takeaway is understanding the impacts of thoughts, traumas, and toxins, and how stressors add up and create dis-ease for baby and for mom. How this walked out in my life and became a catalyst for becoming a pediatric chiropractor, for serving moms, for serving families and kids, and making it my specialty in practice. And then the mission that we have in the LightHouse and the big idea came from my pain, from my journey with my firstborn. Here's the skinny, here's the high points of what I wish.
So Dr. Devin, she is all heart when it comes to what we do. And that's just a snippet. I hope you could hear the strength in her voice and what she's been through. She's had beautiful, perfect births, and she's had births that didn't go the way she thought they were going to go. And it's led her to take care of people and take care of children the way she does today. We're going to hear from Dr. Haley here in just a little bit. But what I want to jump straight into, parents, is that if you're approaching the health of your child, you have a few options, right? Now, the first thing that I want to mention is you're not going to hear me speak ill of medicine. You're not going to hear me medical bashing today. What I think is we have a wonderful medical system. I don't think that's bad, but I think that it's incomplete. Medicine serves a time and a place for our children, but it's not the only time and place. There are other things that people add into their health, like functional or holistic medicine, that also serves a time and a place. Now, I'm a pediatric chiropractor. I'm a neurologically based chiropractor. So am I a little biased? Of course I'm a little biased. But what you're going to hear me make is the case for why the nervous system is important to the health and development of your children, and why if we start there, a healthy life can follow. So I want to start with an awareness test. Now, if you've seen me give this presentation before, or if you've seen this video, please do not ruin it for somebody that you're watching with, but this is an awareness test, so pay attention.
This is an awareness test. How many passes does the team in white make? The answer is 13. But did you see the moonwalking bear?
That pesky moonwalking bear. And there is the point of that video. It's easy to miss something that you are not looking for. That is the case that I'm going to make with neurologically based chiropractic care. Many of you will hear some of the things I'm going to say today, and then you're going to say, Doc, I get it. Like what you're saying all makes sense, but I can't understand and conceptualize all of this. How does chiropractic impact the nervous system? It's important to remember that it's easy to miss something that you're not looking for. So we're going to talk about the sequence of stress in our child's lives and how it impacts them. Okay, so I'm going to lay out here. We've got a bunch of different bullet points here. I'm going to lay them all out. What we find when we look at the children, the cases that come into our office, is that at least half of them, mom had a significant amount of mental and emotional stress during pregnancy. Now, that might not seem like a major thing, but the important thing to remember is that if mom is having an important or a large amount of emotional stress during pregnancy, we know that stress impacts us as adults. Why would we think that it doesn't impact a developing fetus or even an infant or a child? But that's an important start. Oftentimes we'll find that a stressful pregnancy leads to a stressful birth. When we look at birth, we're talking about medical intervention. That could be C-section, forceps, vacuum, induction, epidural. There's a many of different ways that medical intervention at birth is going to impact stress directly onto that newborn. And again, this is something that we've documented in almost 80% of the cases that kiddos come in. Medical intervention is extremely common. We're going to talk about it a little bit more here in just a little bit. Dr. Haley's going to dive into it for us. But then what we'll see is a sequence that begins. Stressful pregnancy leads to stressful birth, leads to a colicky and sometimes constipated newborn. And these are the first symptoms that parents notice when if they bring their newborn into our office, is a baby that just will not calm, constantly upset, constantly fussy, constantly squirming and wriggling, clearly uncomfortable, and also babies that are chronically constipated as well. Now, this is where a lot of parents get off track, is they think that, and they hope and they pray, that their colicky baby is just going to grow out of it. If there's a few words you remember from this talk, is that kids do not grow out of things, they grow into something else. A colicky baby grows into a toddler that has frustration or anger issues and has chronic immune system issues, chronic ear infections. That's the common one that we see. It's easy to look at the kiddo that has chronic ear infections and forget that they were also a colicky constipated newborn, right? Well, then they go and they have their chronic immune system issues, and then they're going to go into a kiddo who's hyperactive or a kiddo who's emotionally stuck, right? And this is also a lot of parents that come in with their 5, 6, 7-year-old, and they'll say it's like, man, it's just in one ear, out the other. Is everything that I tell them, it just feels like we're constantly in this stuck pattern emotionally. They don't respond well to certain situations. They get overstimulated and they forget about what had happened before that. And then it can lead to the anxious and depressed teenager. And this is something that I'm extremely passionate about. I'm going to talk about more here in just a little bit. I don't know about you, but when I was in high school, when I was in middle school, I did not have a bunch of friends who were anxious and depressed. Now, maybe they had symptoms of anxiety or depression sometimes if they were going through a stressful event, but not all the time, not to the point that they needed chronically medicated. So this is an epidemic. This is something that is plaguing our teenagers today, and it's something that I'm extremely passionate about. And then as we grow out of our teenage years, then we're burnt out and we're stressed as adults, and we still have experienced those ADH symptoms. And we're wondering, we think that we're just wired that way, or we just had bad luck when we don't look at the sequence of things that had come before us. And we're going to keep diving into that now. Now, from a chiropractic perspective, there are different types of stress that we talk about in our life. And they're right in the middle of this little graphic here where you see traumas, toxins, and thoughts. And what that represents is physical, chemical, and emotional stress. These are the three types of stress that we put onto our nervous system. Now, the one that gets blamed a lot for kids is the middle one there. It's the toxins. We look at chemical stress. I'm not going to say the big bad V word because hopefully this video doesn't get censored. But in all seriousness, vaccines and medication, they certainly can put stress onto a developing nervous system. But chemical stress is something that's always been there, right? If we look at our childhoods, there was asbestos and lead paint, there was Kraft mac and cheese and Velveeta, right? Like we've always had, you know, there's been poor diets and chemical stress that's been in our life. That's never really gone away. And so that might be a part of it, but that's not all of it. Genes are, genetics, they're a part of it, but they're not all of it. And we have to look at as a whole the physical, chemical, and emotional stress that we're putting onto a newborn or a developing child and how that impacts their nervous system. Now, what it will do, we'll talk about this more in a bit, is there's two major parts of your nervous system. You can see below that where it says brake pedal and gas pedal. When we put stress onto the nervous system, one of the things that it will do is it will stimulate our fight or flight nervous system, our sympathetic nervous system. And that's a kiddo that's on the gas pedal all the time. They are all gas, no brakes. They are stressed all of the time. And it's because that stress got turned on early, right? Maybe as an infant, and it followed them. They didn't grow out of something, they grew into something new because that stress was constantly stuck on. Now, one thing that you're going to hear us talk about over and over is the nervous system, and that the function of the nervous system is to perceive. I'm going to come back to that word, to perceive its environment and coordinate the behavior of all other cells. The nervous system job is to perceive everything that's happening inside and outside of the body. A lot of times when we're dealing with parents, especially when we're talking about their children, they'll tell us like they use the reward system. I tell them, like, as long as you do this, then you're going to get a good outcome. Or if you do something bad, you're going to get a bad outcome. It's like, but again, it's in one ear, out the other. I don't understand. If their nervous system has stress that's stuck on, and their nervous system is not perceiving the words that you're telling them, they're not perceiving the food that's going into their gut, so they have reflux and chronic constipation. Of course their body's not going to be able to control and coordinate the behavior of the cells, right? You're not going to have a good outcome if you don't have a good input. If the perception of the nervous system is twisted, if the wires are crossed, of course we're not going to have the outcome that we're looking for. Now this slide, it's got a lot of words on it, but it's very self-explanatory. Altered perception leads to what we call subluxation. It's a chiropractic term for a misalignment or restriction in the spine that puts stress, pressure, irritation onto the nervous system that leads to altered function, okay? So what you see there in the middle, it says that brains are built bottom up, back forward over time, and that when the neuromotor system is altered, everything else is altered. We know this about our children. We know that they have to have proper physical development. We need kids to start sitting up. We need them to start crawling and walking on time because it's going to impact the other parts of their development. The reality is that if we impact their neuromotor system first, okay, it's going to impact everything else. It's like a game of telephone. If you say a word in someone's ear and the message gets altered down the line, you're going to have an improper output. And we can see very clearly when you look at something like this, how if we alter development early, it's not just going to impact, constipation at a very young age or their immune system when they're 3, 4, 5, but now it's going to start following them. It's going to impact how they are socially or how their behavior and their emotional nervous systems work. So again, we can't just forget that stress early on is not just going to impact them then, it's going to follow them throughout their life if we don't do something about it. So the hierarchy of neurological health and healing has 3 simple steps in sequence. The autonomic nervous system first. Now the autonomic nervous system is your automatic nervous system. It's the things that your body controls without you ever having to think about it. Your heart is beating, your lungs are breathing, your stomach is digesting food. That happens first. The motor system is second, and then the immune system, the rest of your organs, are third. So if we start from the beginning, right, if the autonomic nervous system or the brain is impacted first, of course, it's going to impact everything after that. We can see very clearly how that sequence can follow our children if our nervous system gets assaulted from a young age. Now, again, I'm not going to dive into some of these slides. I want to try to respect everyone's time here, so I'm not going to dive too deep into them. But what you need to remember is that when you think about the genetic code that's impacted or implanted onto your children, and when we think that genes control everything, that's partially true. But what we have to remember is that genes provide a blueprint. Okay, so you see right there, genes provide the blueprint for the formation of your brain circuits, but these circuits are reinforced by repeated use. So what that means is, yes, we are given a genetic code, we're given a blueprint for how our body's going to function, but that doesn't don't always determine, the future of your health moving forward. Your nervous system still is shaping and impacting how those genes are expressed. So I don't want you to fall into a pattern of always blaming things on genetics or always thinking that genetics are the cause of everything. They're part of it, but they're just the blueprint, but it's not exactly how your body's going to express itself. How our nervous system is functioning is very important. Okay. Now, when we look at a baby, we know this about babies, right? They eat, sleep, and poop, right? And we know that if they're doing that, they're doing pretty much everything they need to be doing at a very young age. What happens is that when those things get altered, so if you have a baby that's colicky and not sleeping well, or a baby that's constipated and not pooping well, what we begin to see is how that impacts their early development. So you'll see here in this chart that the early parts of development are the sensory pathways, the vision and hearing, then language, then higher cognitive function. Well, if sensory is being impacted, or if the gut is impacted first, and then we begin to impact language, then this is how we draw down the line when a teenager comes into my office that's very anxious and depressed. And within the first couple of weeks, mom reports to us, or dad reports to us, or the child reports to us that they're sleeping better and their digestion is beginning to regulate. I, as a chiropractor, can give supreme confidence that their nervous system is now healing. And I know we're going to see results with their anxiety and depression, because just like a baby starts with eating, sleeping, and pooping, the same is true for an anxious teenager. We have to get them back to that root cause of what was causing their anxiety in the first place. And it started with a nervous system that was stuck in stress mode. Now, how do we know this? I'm going to show you the technology that we use in our office here in just a little bit. But there's a few basic things that we're doing. We're measuring how much of those three T's, if you remember, that's thoughts, traumas, and toxins. We're measuring how much of these has a child experienced and when did the stress occur. The earlier that it starts, okay, and the longer that it goes on for, typically the more time it's going to take for us to undo. And that should make perfect sense, right? If you're an adult, if you've had neck pain for 30 years, you know that it's not going to go away overnight, right? If it's been there for 30 years, it's going to take time. The same is true with the stress on our children's nervous system. It's been there for longer. It's going to take longer for us to undo. But what this allows us to do as chiropractors is to confidently approach our cases and say, okay, now I know how much care this child needs, and I know how long it's going to take for us to restore the proper way that their nervous system needs to function. There are some incredible quotes that I'm going to share tonight. There's a few snippets out of this one that I really love, but the spine serves as far more than a bunch of ligaments and bones. It is a living, breathing, neurological communication superhighway that is vitally important to the brain, body, and back again, communication, coordination, and control of every other cell, tissue, and biological and physiological system. Then you need to remember is that your nervous system never quits working. When something happens outside, somebody throws a pencil, right? Your hand comes up to catch it. Somebody throws something at you, your hand comes up to block it. You put something in your mouth, your stomach is processing what's going on. It sends a signal up to the brain. The brain processes it, sends a signal back out, and tells the body what to do. That constant flow of communication is happening all of the time. It's happening constantly for our nervous system. And it's one of the important reasons why our nervous system cannot be overlooked when we're trying to get to the root cause of something, because this is the superhighway that our body functions on. Now, subluxation, you heard me use that word earlier. Subluxation is a misalignment, restriction in the spine that puts stress, pressure, or irritation onto a nerve, and it puts our body into stress mode. It turns that stress mode and gets it stuck into the on position. And as chiropractors, this is what we are trying to look for, and this is what we're trying to get rid of. Okay, now we're going to talk through some cases. We're going to talk through some stories, but I also want to go through the science. Okay, now as a parent, I understand that when you see the story of somebody else's child who got well with chiropractic care, you might be saying to yourself, that's great, but how is this impacting my child? I want you to understand, I know that this is important to me, and I know that most parents feel this way as well. Why is important? Why could chiropractic help your child? Scientifically, I'm going to show you why. I'm going to try to keep this as slow and as simple as possible because I don't want to get too deep into the weeds here because I could again talk for hours about this. But I want us to get surface level 30,000-foot view of scientifically how does chiropractic and the nervous system go together. Okay, so the first 5 Ds of subluxation. Now, dyskinesia, the first word up top, the part of the middle of this word here, you see kin. That's movement. Okay, this is what people think of when they think of chiropractic. Something stuck. I'm going to go to my chiropractor. He's going to rack me. He's going to crack me back into place. This is what you think of. Abnormal alignment and movement of the spine. Here's why this is important. 60% of the stimulation of nerve signals up to the brain happen when we have normal spinal movement. 30% of those messages get through just from the cervical spine. So that's just from the neck, okay? So what we can have to imagine is that if we have an area that's misaligned or stuck, especially in our neck, it's going to directly impact the input of signals up to the brain. Dyskinesia, this is the beginning. This leads to disafferentation, which is abnormal sensory input. These are the nerves that are flowing up to the brain. If we don't have the correct signals flowing up because we have dyskinesia, then it's going to lead to disafferentation. This is going to lead to dysautonomia. Now, some of you have probably heard this word before, dysautonomia. If you remember, we said that autonomic nervous system earlier is an imbalance of the autonomic nervous system. It's an imbalance of the brain. If the brain is not getting the right signals, how can it coordinate the proper message to go back out? This is the foundation of dysautonomia, which leads to dysfunction. Okay, that's output. That's the brain sending a signal out to the muscles and joints, out to the cells, tissues, and organs. If we have dysfunction, it's going to interfere with the way the other systems of the body are functioning, right? So one leads to the next. Now, the last one we see here is dyskinesis. And many of you parents experience this, whether you know it or not, in your children. These are children that go all day. It's like you've taken them to the park, you've worn them out, you take them home, and you're like, please just like sit down and give me like 5 minutes here. And they're still going. They're still not listening. It's still one ear in one ear, out the other. They still are just bouncing off the walls, and you are pulling your hair out, wondering how do you still have energy? They are experiencing dyskinesis. When the nervous system gets stressed to a point that the brain cannot understand what's going on, remember that's dysautonomia, and it's not sending out the correct signals to the rest of the body because the wires are getting crossed. The body literally uses energy that it does not have to give because it does not know what else to do. That's dyskinesis. That's abnormal energy expenditure and output. Now, we're going to hop over to YouTube here in just a second. One of the things you hear a lot, right? Phrases we hear a lot is that a picture is worth 1,000 words. If a picture is worth 1,000 words, then this video is worth 1,000,000. Okay, we're going to watch a C-section birth here in just a second. So if you're a little squeamish, then I want you to skip the next minute or so. But this is important. I want you to understand that what we're trying to do here is we're trying to get to the root cause. Okay, so we're going to watch a C-section, and I want you to understand how the stress of birth can directly impact your child's development. Okay. Let's go screen here.
Here's a girl. Here's a girl. Thank you for the camera. Oh, yes. All right.
Now, I know that that is probably not the most comfortable thing in the world for us to sit down and watch. But there's a reason that we do it. And we said it earlier, the moonwalking bear, you can't, it's easy to miss something that you're not looking for. I want you to understand that when I show you that video and when I show you a surgeon that's performing a C-section, I'm not mad at that surgeon. They are doing what they're taught, they're doing what they're trained to do. And they're not viewing what they're doing as damage to the spine or to the nervous system. So this is not me calling anyone out, but you can very clearly see that what we just witnessed was a tremendous amount of stress and strain on the upper part of the neck. When you hand your newborn baby off to someone, especially someone who's maybe never held a newborn before, you're going to tell them support their head and their neck, because we know that their head and their neck is their lifeline, right, to their brain. You can very clearly see that what we just witnessed was a tremendous amount of stress and strain. It takes a tremendous amount of force to pull baby out when you're performing a C-section. And again, this is not to point fingers, especially if you're a mom that's been through this. This is not for me for you to experience guilt or shame, because life happens, and sometimes C-sections are necessary, but we need to understand the repercussions of what's happening when that happens. And when it comes to C-sections are sometimes very necessary. Sometimes, not sometimes, when many times when they're performed, they save lives. They save the mom's life, and they could save the baby's life. This is not to say that C-sections never need to get used. But if we look at this chart, do C-sections need to get used as much as they are today? I'm not going to answer that question for you. I think most of you probably know the answer. The female body was made to give birth. I'm going to have Dr. Haley talk about that here in just a second. But we can watch this trend, and what we can do as observers is understand, okay, if C-section rates are going up, if medical intervention rates are going up, we have to understand the repercussions of that. But this message that you're about to hear from Dr. Haley, especially is if you're an expecting mom, maybe you want to start a family, I want you to understand that the human body, the female body, was made to give birth. And Dr. Haley's going to show you that here in just a second.
Your system, it creates stress, which isn't great for our health, let alone the environment that we are creating for the child in our womb. So the way that I overcame this over the years was recognizing that God designed me specifically and intentionally to be a vessel that brings life into this world. That is the primary purpose, the primary piece of the design of the woman. And operating in that confidence helped me go into birth with a different mindset.
What I love about that message from Dr. Haley is so many moms are told nowadays that, baby's too big, you're measuring too far along, we got to get you in there and get that baby out of there. There's so much more that we could hop into with that, but I love that message from her that fear does not serve you when you're trying to go into a pregnancy and into birth with the expectation that you're going to have a great outcome. Okay, now even if birth goes perfect, right, what we need to understand is that even the most perfect vaginal birth can still put stress on the spine. This is a study done here that was looking for somatic dysfunction, which is subluxation. That's what it is, of the spine. And they found that in 99 out of 100 infants, at least one pattern of subluxation was found. So this is happening the vast majority of times to our kiddos, even in the most perfect births, can still put stress and irritation onto the spine and onto the nervous system. This is a slide. There's so much to go through. I'm going to have to skip this one, but just remember that in the last 5 years or so, we've done some research. Chiropractic adjustments directly impact the brain. It does not just impact the area of the spine. This is why I can talk about these things with such confidence, that all of these different things, fear, anxiety, situational awareness, attention, inhibition, cognitive control, I can talk about it and know that chiropractic impacts it, because we know that chiropractic impacts the brain. This is one of my favorite quotes of this entire series. You can't be in growth mode and protection mode at the same time. It is so true when we're talking about the different parts of our nervous system. When you're looking at your child, if you're worried or concerned about their development or about some of the health struggles that challenges that they're facing, what you need to remember is to not feel guilt and shame that they're going through that, but it really is to be forward thinking, to remember this is not just impacting them now in this moment, it's impacting their growth moving forward as well. The vagus nerve and sensory processing disorder, Dr. Jess is going to drop a little file into the chat right now. It's a little cheat sheet that I've made for ways that you can impact the vagus nerve for your family and for your children, for yourselves. The vagus nerve is an incredible nerve that we are lucky enough to track with one of our pieces of technology that we use. I'm going to talk about it in just a minute, called HRV. But what we found here, this is a bunch of PTs and OTs that found that kiddos that have sensory processing disorder, they could directly track how their nervous system was functioning with HRV and equate it to outcomes. If we can improve the way that the brain is processing things, it's one of the things that we're looking at with the vagus nerve. We know that we're going to improve the way kids' social skills are improving, their communication, and just their daily living skills when it comes to sensory processing. Now we're going to look at a couple of cases here. Okay, now over on the left side, what you're seeing are some nerve scans that we've done. I'm going to talk about these more here in just a little bit, but this is Evan. What you need to know about Evan is that he had a really tough birth. He was extremely colicky. He had sensory processing going up, extreme constipation issues, and he was told by medical doctors that he was going to struggle with this for the entirety of his life. Let's watch his video.
Yes? Yes? You love it, Kristen? Say yes.
Now, this is Evan after a few months under very consistent chiropractic care.
What is it? A dog.
Now, what Evan's parents noticed immediately is his physical capabilities improved. He was walking better. They could tell that his coordination was improving, but his eye contact, that was the one thing that they said over and over, was that his eye contact was better, and they knew that's how his nervous system was improving. Now, Charlie, this is one of my cases from, I had an office in South Carolina, and this is one of my cases here, Charlie. Charlie is near and dear to my heart, but Charlie came to our office when he was 18 months. He was induced. He had forceps and vacuum at his delivery, but he struggled with extreme colic and constipation. But at 18 months, he was nonverbal, and the doctors told his mom that he was probably always going to be nonverbal. He was never going to go to school, and that he was going to need lifelong care from his parents. So that video is of Charlie when he was in kindergarten. Um, he required very little special attention at that point. He'd made it to kindergarten. He was thriving. His teachers had told mom he was doing really, really well. He was tracking right along with other kids. And his life was changed. Now, over there on the right, you see his scan. What I want you to notice, there are some common patterns that we see in infants, especially. That we'll see where you see any colored bars on these charts are where we see nerve irritation. A lot of times it's all the way up at the tip top part of the neck. That typically stems from birth. And a lot of times we'll see it much lower down into the low back and even into the hips and tailbone. This is an area, as kids are beginning to learn to crawl and walk, they're constantly falling on their butt. We typically do see a lot of irritation at the base of their low back and tailbone. And a lot of times too, while we'll see constipation and other digestive issues as well. Now, again, this happens to infants, but then it doesn't grow out of something, they grow into something new. And so a lot of times we'll see kiddos that develop those chronic ear infections and immune system issues. And then as they get into their adolescent years, then they start struggling emotionally. They have these anger outbursts that mom and dad just cannot control. And these are just a few of our cases where we see mom and dad consistently coming back. Yes, we can show you these scans all day long, but we're seeing the fruit of our labor in the way that these kids are communicating with their family members, they're communicating with their parents. And then as they grow up into grade school, this is where we'll see kids having emotional outbursts at home, but now they're starting to have these sensory processing issues that are boiling up to the point that they're having emotional outbursts at school. And then we will see children not only doing so much better at home that mom and dad see it, but teachers are reporting back. Their grades are back on track. They're doing so much better with their fellow students. What are you doing differently? And a lot of times it's one simple change. It's we're getting their nervous system back on track. Now, we over there on the left, you see some of those nerve scans up top. And then on the bottom, there's another scan. This is the HRV scan, heart rate variability. I mentioned this briefly earlier. We want to see a scan that's moving up into that green zone, that little white dot. When you can see it further away, kids struggle more. And the closer we get it and into that green zone, the better they're going to do. And then we move into teenagers. And this is, again, this is where I get really passionate. You see Dr. Devon on the left over there with her son, Roman. This is her oldest, and she tells a little bit of her story. If you follow her YouTube link that we have in the comments. And Roman is a really special story to Dr. Devon, but even some of the other kids that she has taken care of here at the Lighthouse that I had the pleasure of taking care of at my office in South Carolina, I just do not think that kids should struggle with chronic, anxiety and depression and think that medication is something that they have to be healthy. Because the reality is that we're born to be healthy. We just have to do the necessary things to get our nervous system back on track. Now we're finishing up here. We're getting to the end. I know it felt like we never probably were, but you have action steps. Again, I want you to email me if you have questions. On a serious note, if you're a parent and you're watching this, you are your child's advocate. I do not want you to ever lose sight of that, ever lose hope that you can find answers and that you can find your child help. Okay. Now, I'm going to talk to one of three people right here. If you've never been a patient at the Lighthouse or your child's never been a patient, I want you to schedule your consultation, your neurological scans, I'll talk about in a second, and your report of findings. We're gonna offer a special discount for you. So if you do go onto our website and tell us that you found us from our Light in the Dark workshop, we're going to make sure that you get a special discount for that. But I don't want you to wait. I want you to come in and see. I'm not going to tell you with certainty that if your child's experiencing these symptoms that I can help you. But what I can tell you is that you will learn more about your child's nervous system and you will not regret bringing them in to find out how their nervous system is functioning and if we can help them. You might also be a patient at the Lighthouse. Maybe you've never brought your child in, or maybe you brought your child in, but some of the things that I've said today have struck a chord and you want to learn a little bit more to see if we can help. We're also going to offer a special discount for you as well. So the next time you come in and you want to get your kiddo scheduled, we want you to do that. Go right up front to see our front desk staff and we'll be able to do that. Okay. Maybe you don't live in Wichita, Kansas, and you can't come to the Lighthouse as much as we would love to serve you. We are lucky enough to be connected with chiropractors all over the country and really all over the world. So if you know somebody living somewhere else that needs to hear this message, I want you to send them this workshop. And then if they need help finding a chiropractor in their home city or state, we can help them do that. Okay. Now, what does our process look like in our office? The first part that many people are surprised by is that their consultation is sometimes the longest part of their visit. We dive really, really deep because, again, we want to understand pregnancy, birth, early childhood. If we're dealing with a teenager, we want to know everything in between. We don't want to leave anything to chance. We want to understand everything that you or your child has been through. And that sometimes means that we ask you questions that you haven't been asked before, but it's an important part of the process. Then we move into the neurosensory stress scans. And this is where we get to quantify and qualify. Is this a chiropractic patient? Is this something we can help with? If it is, then we also get to tell you how much stress is there on the nervous system. And we get to put all of that together to tell you, okay, here's how much stress there is, and here's how we're going to help get your child to the other side with a report of findings and care plan. And again, that's not something that we take lightly. When we get the opportunity to take care of a child that's struggling, we know that a lot of times we're not the first place that you come to. And we're going to do everything that we can to help get your child's nervous system back on track and to get them the answers that you've been looking for. Okay. Now, I wish I had time to go through questions. If you have a question, I want you to email me. I just want to go through a couple of the common questions that we get. How long is this going to take? What you need to remember, this is true even if you were an adult patient coming to see us. The brain's ability to change in response to experiences is that blue line you see on this graph, and the amount of effort required to make that change is the orange line. We can see that as we get older, it takes more effort to change. The earlier that you bring your child into us, and this is why we recommend, I wish every baby would get checked by a pediatric chiropractor, but we recommend that you bring your child in as soon as possible so that we can make these changes as quickly as effortless as possible. And then my favorite one is, how are you ever going to get my child to sit still for an adjustment? They're not going to get up on that table. And what I will tell you is that we will adjust kids on the table, under the table, in the chairs and couches of the rooms, in the lobby, in the waiting room, on mom's lap, while they're reading a book, while they're playing a game. If there's a will, there's a way. I have never had a child that could not get adjusted in our office. We will take our time, we will take your time. And we always say that, this is their house. We just work in it, and it's true. We're lucky to serve your children. We're lucky to serve your families, and we don't take the opportunity that we have lightly. So I want to finish by saying again, thank you for taking the time. I know that you didn't have to sit down and take this 45 minutes to watch this video, but I hope that something I said struck a chord for you or for someone that you know that needs to hear this message. Pass this along if there's somebody that you know that needs to hear this. And again, don't stop, don't stop seeking answers. Don't lose hope. The answer is out there, and your child is born to be healthy, and we want to help get them there. So we love you so much. God bless you all. We'll talk to you soon.